We are finally starting to feel that October chill in the air. It's the busy season for local apple orchards and pumpkin patches, and it won't be long before kids are putting on their Halloween costumes for trick-or-treating. But with the ongoing pandemic, families may still have COVID concerns when it comes to fall activities. KIMT News 3's Annalise Johnson joins us live with the latest advice from Mayo Clinic. Annalise?
Katie, I'm here outside of Halloween Express in Rochester where people are buying their costumes and decorations to get ready for the holiday. Today I heard from a Mayo Clinic pediatric infectious disease specialist about how you can celebrate the spooky season safely. What's your favorite thing about Halloween?
That I get some candy.
Do you have a favorite one?
Bubblegum.
London will still be getting her favorite candy this year, but her Halloween may look a little different than past years. COVID recently hit close to home for her family, so her mother, Sina Venn, says they will likely be keeping their Halloween small.
Having our daughter exposed to, just a few good friends around is good enough for us, and she doesn't really need too much.
Dr. Nipuni Rajapakse, pediatric infectious disease specialist at Mayo Clinic, says that any outdoor fall activity like trick-or-treating, apple picking, or visiting a pumpkin patch is low risk. The risk grows if you're gathering indoors, but you can reduce that risk by limiting the number of people, getting together with only vaccinated people 12 and up, having good ventilation, and masking. Generally, she recommends against indoor celebrations.
Halloween is kind of a unique holiday in that masks are already kind of built into it.
Dr. Rajapakse advises your family masks up for the holiday, whether it's a surgical or cloth mask or a Halloween mask, as long as it covers the mouth and nose. No need to double up on masks, but make sure your child is keeping their face covering to themselves.
We would advise against any sharing of masks. Obviously, they're in close contact with respiratory secretions, and so sharing a mask from one child to another would be a high-risk activity that could transmit infection.
After your kids reap the benefits of their trick-or-treating, hand washing is always a good practice, but wiping down your kids' sweets isn't necessary because surface transmission of COVID-19 is low.
We know that for COVID to be transmitted through a surface, what has to happen is an infected person would have to cough on whatever the item was. You'd have to touch it. You'd then have to touch your eyes, nose, and mouth with enough virus on it to make you sick. And the statistical likelihood of that happening is really very low.
The spotlight may be on COVID-19, but there are other respiratory illnesses to keep in mind as well. This is the time of year when people are getting sick with influenza. Last year's flu season was nearly non-existent because COVID-19 restrictions were so strict, but Dr. Rajapakse is less optimistic for this year because those precautions are more loose. Live in Rochester, Annalise Johnson, KIMT News 3.
Thanks, Annalise. Now, experts say if you had COVID, have had a recent exposure, or have recently been tested for COVID-19, they say you should not take part in Halloween festivities, not even giving out candy.